Hello everyone, and welcome to this overview, of this research poster presentation and some works looking at a review on Crouzon syndrome or CS, and this work this works or the background to this works was a collaborative effort between some students at an academic institution where the students were sort of undergrads in undergrads and sort of postgrad in amongst biomedical sciences, but also some postgrad sort of pharmacology students, and where the collaboration was between the academic institution and the social media platforms, the RPSG, Renal Patient Support Group, and the Kidney Disease and Renal Support Group, or KDOS group, for kids. So this is so to also say, as part of this overview, this is a this overview is not particular to children and young people that go through sort of kidney illnesses, kidney related illnesses, but it is a condition, a healthcare condition that is specific and particular to the sort of neurological and sort of the sort of the and in around aspects of in around the development of children and young people, where they for example, where Crouzons or Crouzon syndrome forms a diagnosis. So, in on this sort of overview of this research poster presentation, a little bit around this by starting with an intro. So, Crouzon syndrome, or CES, is sometimes referred to as a brachycephaly syndrome, and is a rare sort of autosomal genetic disorder or condition that was first sort of conceptualized or described by an investigator, Louis Edouard Octave Crouzon, in around the 1900s, and particularly around 1912. And it is characterized as a triad of cranial deformities, and specifically where the cranial deformities form what's referred to as craniofacial dysostosis, and facial anomalies, and also sort of protruding eyes, as protruding eyes in context of how sort of skull development sort of pushes or can push the eyes, or the sort of eyes out in children, young people, with who are diagnosed with this particular condition. So it is inherited. Inherited in an autosomal dominant pattern, and is responsible for a wide range of phenotypic severity within the same family, and it is one of the second most common phenotypic severities within phenotypic severity within children and young people who are diagnosed in the same family, and it is also one of the second most syndromic conditions aligned to what's referred to as cranial synostosis, caused due to the mutation in the genetics, in particular genetics of the fibroblast growth factor receptor 2, and the gene on chromosome 10, in around chromosome 10, and particularly chromosome 10q25 and 10q26, and in around additionally where there is anomaly in around the fibroblast growth factor and receptor 3, also on FGF, or what is abbreviated as FGF R3 gene on chromosome 4 that also results in disrupted cell growth and development. Some investigations have also suggested a sporadic de novo mutations that may also occur, according to approximately just under 5% of all craniosynostosis cases as caused due to Crouzons. So now going into some of the genetics in around this, according to retrospective works, gain of function mutations in FGFR2 gene are found in the FGFR gene, are found on chromosome as mentioned aforementioned on chromosomes 10q25 and 10q26 are core and cause the main anomalies surrounding Crouzons. Exons encoding the extracellular immunoglobulin and domains, immunoglobulin-like domains, and are usually affected by these mutations, which change the ligand binding and encourage constitutive receptor activation. Mutations of in around the FGFR3, namely in around particular mutations of the FGFR3 fibroblast growth factor 3 or receptor 3, and where there are sort of mutations or there can be mutations in around this, are responsible for about between 5 to 10% of Crouzon cases, especially those linked to what is referred to as the as specifically or particularly in acanthosis nigricans. These variations result in overlapping but different manifestations that include cranial abnormalities and hyperpigmented plaques in intergenous regions. The mutational range have been broadened by more recent genomic investigations. Atypical CS with binocular strabismus was associated or is associated with new FGFR2 mutations. It is its pathogenicity is or had been confirmed by functional investigations that showed ligand independent receptor dimerization. Milder or atypical manifestations have been linked to other variations that include exonic deletions and splice site alterations. So now looking in around the signaling pathways before going into the particular aims of this works. So the transmembrane tyrosine kinase receptor encoded for FGFR2 facilitates osteogenesis. So that is in around the development of particular bone, in around the development of bone by means of fibroblast growth factor signaling to control over osteoblast proliferation and differentiation. Activation sets of downstream downstream of particular pathways, and to promote early osteoblastic development and ossification at sutural locations. So in this research poster presentation, you can see some illustrations here in around where in around the cranium, in around the cranium of children, young people can be where children and young people are diagnosed with CS. You can see where where in the illustrations where, for example, there can be anomalies in the development of the cranium of young people, of children, young people. So it is where where there can be uh, anomalies in around the sutural locations, but also where mutations intensify receptor signaling due to compensatory expansion at patent sutures, which result in asymmetrical skull morphologies and mid facial protrusions. This aberrant ossification, or the aberrant ossification, interferes with cranial morphogenesis. So what this means, listeners, is generally where there would be normal sort of suturing or frontal suturing where skull development occurs or should occur. It is where the anomaly or abnormality is in around the morphogenesis, in around the normal morphogenesis of skull development, which is affected in those with Crouzons or diagnosed with Crouzons. So dysmorphic cranial development is further exacerbated by disruption of dura suture signaling feedback loops. Animal investigations with conditional FGFR2 fibroblast growth factor receptor 2 activation mirror human Crouzon's characteristics, including early suture fusion, abnormal cranial basal angles, and maxillary hypoplasia. These models, or the animal investigations that have taken place in amongst where investigators have looked to mimic and investigate Crouzons. The laboratory investigations in animal models have emphasized the possibility of targeted pathway regulation, and the part aberrant fibroblast growth factor gradients play in the spatial patterning of osteogenesis. So again, where investigators or literature informs in around where there are there can be varying sort of spatial sort of osteogenesis and the development of bone in around those children, young people diagnosed with Crouzons. In amongst the aims of this particular works was a review to provide a sort of a comprehensive overview of Crouzons, encompassing its genetic basis, its sort of clinical presentation, the diagnostic approaches, and the current management strategies. So now looking into some of the clinical manifestations. So brachycephaly or a short anterior posterior skull are the main symptoms, or some of the main symptomologies of Crouzons, which is characterized by premature cranial sutural union. So again, in the illustrations in amongst this presentation, you can see where there would be normal where there would be normal cranial suturing, and where, for example, the where cranial sutural union would be abnormal. Additionally, so usually this is referred to as bicorporal, shallow orbits or proptosis and hyperteres telorism and sort of occur. And what this is and then in around this, it is it's just to iterate the hypertelorism and the proptosis are sort of the symptomologies that give Crouzon's recipients or Crouzon's patients the sort of beaked a sort of a beaked nose, as in context in context of how, for example, the symptomologies bring out some of the protrusion in around their nasal feature, around their nasal structure, and mid-face hypoplasia because of the maxillary protrusion are characteristics of the Crouzons faces of the Crouzons conditions. Class 3, what is referred to as class 3, malocclusion and relative mandibular prognathism or pseudo prognathism are outcomes of the mid-facial deficit. Common conditions include bifid uvula, high arch palate, and dental crowding. Proptosis and orbital shallowness result in ocular problems such as strabismus, exposure keratitis, and optic atrophy. Neurological complications are sort of frequent due to restricted intracranial volume and altered CSF or cerebrospinal fluid dynamics. And according to some reports or some investigations, around 30 to 40% of recipients of Crouzon's recipients experience elevated intracranial pressure, and one of the most significant after effects and development regression, papilledema, optic nerve atrophy, and extreme situations such as where there can be extreme situations that can all result from the from in around the ICP, both venous outflow blockage and mechanical constriction of the cranial vault are part of the CS or Crouzon's pathogenesis. Up to around 70% of Crouzon's individuals with syndromic craniosynostosis have Chiari one malformation, which is characterized by the herniation of the cerebellar tonsils through the foramen magnum, and vigilant monitoring is necessary since magnetic resonance imaging or MRI frequently shows posterior fossa crowding and brainstem compression. Chronic cerebral hypoxia or hypertension can also lead to seizures and developmental delays in Crouzons in young people diagnosed in young people who have been diagnosed with Crouzons. So now looking in around some of the gene therapy, some aspects around the gene therapy. So the chief molecular pathway affected in pathogenesis of CS has been in around FGFR2 pathway, and as such, novel approaches are centered around this are still being investigated or have been investigated, but also where symptomology is aligned to similar conditions like that of CS are also being investigated to understand the sort of the basis of CS. So the challenge with gene therapy, however, for this particular condition is or has been around to formulate formulate sort of the delivery of systems for the target mutant gene or genetics, and minimizing the off-target effects. most notably developed developed a investigations have highlighted a biocompatible system to deliver allele specific small interfering ribonucleic acid or siRNA to knock down expression of the mutant FGFR2 gene in patients derived suture cells. Additionally, however, or at least thus far, recombinant proteins and recombinant antibodies and sRNAs have been used in vivo and in vitro in animal investigations. However, ongoing genetic studies investigations in Crouzons promise to elucidate more targets for particular genetic or gene therapy. So in around some aspects of diagnostics, then growth factors, so growth parameters, including head circumference and velocity, and are documented or have been documented. Cranial morphology is also characterized and ocular alignment, corneal exposure, and optic disc appearance are assessed, and midfacial retrusion and occlusion are evaluated with early orthodontic involvement when indicated. Distinguishing positional plagiocephaly from synostosis deformity remains essential. Low dose chromatography with a 3D reconstruction sort of has remained sort of the gold standard for delineating suture fusion patterns and cranial base morphology and orbital anatomy, with increasing adoption of dose optimized protocols to minimize cumulative child or young or yeah sorry in around the childhood in around to minimize the cumulative childhood radiation exposure. MRI is sort of reserved for evaluating hydrocephalus, particularly venous outflow anomalies and hindbrain crowding or optic pathway, which can be compromised, and is particularly valuable or important in the setting of papilledema or suspected elevated intracranial pressure. Manage in around some of the management aspects, and sort of closing, and in closing, CS or Crouzons illustrates how coordinated multidisciplinary care can transform the outcomes in complex craniofacial disorders. Early identifications, structured surveillance of intracranial pressure, vision, hearing, and sleep, and stage craniofacial reconstruction supported by audiological, orthodontic, and speech and language and speech interventions are central to preserving neurodevelopment and protecting ocular and airway function, and achieving long-term dental and facial stability. As advances in surgical and technical surgical techniques and perioperative care continue, adherence to multidisciplinary standards informed by molecular diagnoses and patient-specific pathophysiology still remain the most important determinant of prognoses. There are some citations or references that can be referred to if if listeners want to if listeners want to identify some similar literature in around Crouzons and Crouzons and Crouzons like conditions. One of the main conditions, just to iterate in closing, specifically is in around Crouzons and cranial and Crouzons, and where Crouzons is linked to cranial synostosis. That ends this overview of Crouzons review in as part of this research poster presentation overview.